who has seen much advancement in treatment and policy, does it surprise you that HIV continues to impact our community in such a devastating way?
It does not. I alluded to it very early in my earlier comments. The fact of the matter is that African Americans, we're stuck in the late 80s, early 90s when it comes to understanding HIV and our risk factors. We don't believe that this disease is something that will happen to us. It's really interesting because many of us know someone with HIV. It's just that we don't think that it would happen to us, or that we think that our cousin, he has HIV because he was gay, or that my aunt has HIV because she was an IV drug user. And so we don't see that in terms of how it could impact us in our daily lives. And so how we perceive HIV, I believe, continues to drive HIV cases. So we don't change our own behavior. And there's some socioeconomical connections here too. We have a huge portion of black men that go into prison for minor crimes like drugs, and they go in negative, they come out positive, and then they date. You know, they come back out and they continue to date the women that they dated when they went into prison. And so that's an issue that we don't address. We have not really addressed the fact that there is an IV drug issue within our community. We spend a whole lot of time talking about crack cocaine. America spends a whole lot of time talking about meth, but no one really talks about IV drug use and its prevalence unless a famous actor has a heroin overdose in a hotel. And so we don't really address some of these fundamental issues that affect people, affect the drive-in cases around HIV/AIDS. The stigma is so prevalent that the cycle is like this. People don't know their HIV status. They don't go get tested. People are afraid to go get tested because they don't want to know their HIV status because they think that people will perceive them differently. They will think that their life will change somehow. So because you don't know your HIV status, one, you infect someone else, okay? And so that cycle keeps going. African Americans find out their HIV status not during the HIV stages, but by the time we've already transferred to full-blown AIDS, which means we've been infected somewhere between 8 to 10 years because we don't know our HIV status. So there is this vicious cycle that continues to flow within our community, mainly because we are stuck we're stuck a decade behind in who gets HIV. It's amazing to me that when I post a statistic on Facebook, how African Americans immediately say, no, they're lying on us, they're lying on us. And so that we can't have it both ways. We can't do the real education in truths and honesty about where we are in this epidemic. If we don't accept that we're here in this epidemic, we can't get out of this epidemic. And that is probably the most disheartening thing, that HIV is a 100% preventable disease. We don't have to get HIV. We can change these statistics. It's saddening to think that black women are still having babies with HIV when that is probably one of the most miracles around treatment and care around HIV, reducing perinatal transmission. And so a lot of these issues that compound HIV, the increase in cases of HIV, are rooted around the issues of stigma and shame, especially in places like the South. The PBS had a special recently, about a year ago, where people actually threw someone's refrigerator out because they thought that you could get HIV from a dead person's refrigerator. And I know some of you all are sitting here saying, oh, who would think that? But there are people who still think that. And so education is still very, very key, very, very prevalent, very, very relevant as another vehicle to reduce cases around this disease.
Thank you, Ms. Lewis-Thornton.